Cataract surgery is a common surgical procedure. During this surgery, the cloudy lens of your eye, which we call a cataract, is removed and replaced with a clear artificial lens. While it's a relatively quick and painless procedure, the recovery process is crucial to achieving the best possible outcome. In this video, I'll talk you through what to expect in the days, weeks, and months following your surgery and what to do to help you recover properly. I'm Miss Zahra Ashena, a consultant ophthalmic surgeon at Shirley Oaks Hospital in Croydon, and I've been performing cataract surgery for over 14 years, so I can talk you through the whole process. What happens after surgery? You might have chosen to get cataract surgery to restore clear vision that has been clouded by cataracts. Right after your cataract surgery, you'll be taken to a recovery area where your eye will be monitored for a short period of time. You'll be given a protective shield to wear over your eye to prevent you from accidentally rubbing it or getting it infected. It's important to leave this shield on for as long as you are advised to. Most surgeons advise you to keep the protective shield on at nights or if you go outdoors during the daytime in the first week after the surgery. Most patients are able to go home within an hour after surgery if a local anesthesia was used. But remember, you won't be able to drive yourself, so make sure you have someone to take you home. The key points to remember straight after surgery are as follows. Get plenty of rest. Take it easy for the rest of the day. Avoid any strenuous activities or sudden movements. Follow the instructions you were given. You'll be given eye drops to use which are essential in preventing infection and reducing inflammation. Make sure to use them exactly as prescribed. Protect your eye. Wear your protective shield, especially while sleeping, to avoid accidental injury to your eye. Avoid touching your eye. It might feel itchy or uncomfortable, but try not to touch or rub your eye. What to do in the first week after surgery? During the first week after surgery, your eye will still be healing. It's normal to experience some blurred vision, mild discomfort, or a feeling like there is something in your eye. This is all part of the healing process, but if you experience severe pain, significant vision loss, or frequent flashes of light, you should contact your ophthalmologist immediately. The key points to remember for your first week after surgery are: avoid water and dust. Keep your eye away from water, soap, dust, and other irritants. When showering, make sure no water gets into your eye. It's better to take a bath rather than shower in the first week to avoid this. Avoid activities like gardening. When gardening, the hands can get easily contaminated by the soil and germs. This can transmit to the eye and get into the wound, causing a nasty infection which is potentially blinding. Wear sunglasses. Your eye may be sensitive to light, so wearing sunglasses when you go outside can help. Avoid strenuous activities. Avoid heavy lifting, bending over, or any activity that could strain your eye. Continue to use your eye drops. These are essential for preventing infection and inflammation. Long-term care and follow-ups to your surgery. Around 1 to 2 weeks after surgery, you'll have a follow-up visit with your ophthalmologist. This visit is to check that your eye is healing properly and to test your vision. Depending on how you are progressing, additional follow-up visits may be scheduled. Long-term care tips post-surgery are as follows. Follow your consultant's advice. Always follow the advice given by your ophthalmologist regarding eye care and medication. Be patient. Complete healing can take up to 8 weeks. During this time, your vision may continue to improve gradually. Change your current use of glasses. If you had a cataract surgery with trifocal lens implant, you are likely to see well without glasses. If you had cataract surgery with basic monofocal lens implants, you are advised to see your optician approximately 4 weeks after the second eye surgery for an updated eye test and glasses. Report any unusual symptoms. If you notice any increase in pain, redness, or vision problems, contact your ophthalmologist immediately. Ways that your vision may improve. Most people experience a significant improvement in their vision after cataract surgery. Colors may seem brighter, and you'll likely see things more clearly. It can be an exciting time, but it may take a few weeks to fully adjust to your new vision. Don't be surprised if you need new prescription glasses. This is quite common and helps optimize your vision further. So, overall, recovering from cataract surgery is a crucial step towards restoring your vision and improving your quality of life. By following these guidelines and taking good care of your eyes, you can ensure a smooth recovery and enjoy the benefits of clearer vision. If you have any concerns or questions during your recovery, don't hesitate to reach out to your ophthalmologist. So, that's a brief guide to recovering from cataract surgery. If you have any more questions, feel free to leave them in the comment section below. If you would like to arrange a consultation with me or another consultant in your local area, you can call us or book an appointment at circlehealthgroup.co.uk.